by how do we approach drug ads. Drug ads are usually long-winded. They might take a lot of time to read entirely, so we do not read them entirely. They are in sequence, meaning that there are usually 3 questions. There might be 2 questions, but rarely. And the gist to them is to know how to approach them rather than how to solve them. The solution is already there. Firstly, we read only the question, meaning the last sentence. You will be asked, for example, if the patient might benefit from the drug. And you will have a lot of data on the drug ad. So you have to look for significant classes. For instance, you will have an efficiency for diabetic patients, an efficiency for patients with heart failure. You do not go yet to those sections. You do not look on that information. You have to restrict all your information gathering to maximum 5 elements. So the first element is the question. For instance, in this case, would the patient benefit from the drug, let's say. Then you go to the class the patient might be. So you go at the start of the vignette and you skim for the enumeration of his medical history, heart failure, diabetes, etc., etc. Once you got those underlined, you go and look on the drug ads at the classes, and you'll see heart failure, but maybe you won't see diabetes. So you go to heart failure and you look for significance, so P value under 0.05, or you might have a relative risk. In the case of the relative risk, you want to have a confidence interval that actually does not include 1, and if you want to be beneficial, it has to be below 1, and if you want to demonstrate that it's a risk for the patient, you have the relative risk above 1, but not including 1. The same for odds ratio. Okay, as I told you before, you have to skim the patient's presentation to align her conditions with ones on the ad.